Amelia. How's everybody doing? Thanks for joining us today on a Thursday afternoon. It's very important information, and we're happy to have some experts here that are going to talk about things that could help your municipality, could help your county, could help your school board. First of all, I'd like to thank one of our sponsors, Lou Alamo, who's a dear friend from the Alamo Insurance Group. Lou, can you tell everybody, your elevator pitch, what you do, who your clients are, and how you could help them?
I am happy to, Carlos. Thank you for inviting us to co-sponsor the event today. I would have co-sponsored it just for an opportunity to introduce you as my friend. So, Alamo Insurance Group is primarily comprised of two divisions, a large group employee benefits and risk management consulting. We're approaching our 23rd year in the business. We pride ourselves on bringing pragmatic private sector business approach, hard bottom line approach to public sector. We are a public sector insurance brokerage and consulting firm with clients as large as the largest school district in the state to small local parking authorities and autonomous agencies. Trading on the merits of our work, the results that we've delivered our clients, the experience of our group of executives and the incredible competitiveness that they bring to the market. We are also the state of New Jersey's largest minority business enterprise in our space. And we've been told that we're in the top 5 nationally. So all of this we owe to our affiliations, very much so to my friendship with Carlos and with the statewide Hispanic Chamber. Bless you all for joining us.
Thanks, Lou. And now we're going to have a presentation from the gentlemen who are our main sponsor today, Peter Rohrig and Dan Madden from SiteLogIQ. Thank you for joining us, gentlemen. And I know Erica's going to help us kick off a slide. The idea, again, is, COVID-19 has forced us to pivot. It's been a crisis, but how can your municipality, how can your county take advantage of money, 75% of project costs, to make your facility safer? Not enough people are taking advantage of this, and these gentlemen are going to explain it to you. This is going to live on Facebook. You're going to be able to call us, get more details, but please share this with your networks. 75% covered by FEMA. Your town, your county only has to come up with 25% of the project costs. Without further ado, I'll let Erica kick it off, and you gentlemen could kind of go over at the same time.
Thank you very much. Thank you, Carlos, for hosting us today, and Lou for helping sponsor this event. We're really proud of our engagement and participation with SHCC. We're very proud of the community and all the great work that Carlos and his group does across the state every day. So, I'll be brief and get to your questions as soon as possible. And thank you for joining us today. My name is Peter Rohrig. I am an account executive with SiteLogIQ. I am joined today by my colleague, Dan Madden. We are both have been involved in over 20 years in the New Jersey marketplace. And we are currently assisting school districts, municipalities, and counties across the country, including New Jersey, on restoring community confidence, leveraging federal funding by installing proven technologies to address airborne and surface spread of COVID in the indoor built environment. So this includes everything from ionization, global positioning, bipolar ionization, to ultraviolet germicidal radiation technology, a host of HVAC solutions that not only help mitigate indoor spread of COVID, but also help save energy at the same time, and a host of other solutions. So we'll get into that in detail. We'll discuss with you available federal funding to help pay for it, not only just FEMA federal funding from the Public Assistance Grant Program, as Carlos highlighted earlier, through the CARES Act, but the Coronavirus Relief Fund. That's a U.S. Treasury program. New Jersey received over $3.4 billion from that. $1 billion of that went to New Jersey counties, 9 of the largest New Jersey counties, and only 11% as of August 12th has been spent. That leaves over $900 million from the Coronavirus Relief Fund that has been unutilized. And based on current guidance from the U.S. Treasury, it has to be allocated by December 15th, or else it's going to be clawed back. So we look forward to speaking with you today about ways that you can comprehensively and effectively and in a cost-effective way implement these solutions to help restore community confidence, because it's not only just about reopening, it's about staying open. So with that, next slide, please. So a little bit about us. So SiteLogIQ is the largest independent, privately owned facility solutions and energy services company in the country. We operate in over 30 states, and we have over $5 billion in construction projects completed, and with over 700 employees. We have a robust operation in New Jersey, and we're currently expanding across the country, and look forward to helping assist you and your colleagues and communities through in the years to come. Next slide, please. So we like to call our work assisting clients with the COVID pandemic, the continuum of readiness, which started in April and May with our restoration work, helping sanitize buildings, help right-size budgets, help folks with connectivity issues so that at-home work could be implemented in a fast and effective way. That quickly pivoted to preparations for reopening, including strategic planning and risk assessment planning. SiteLogIQ traditionally is a facility master planning solutions provider. So we come in and help our clients get their hands around all their facility needs within the constraints of funding over a long time horizon. And so it was a short pivot to get to our ongoing work helping clients with engineered infection protection and energy solutions, which is what we're largely focused on now as we look to the fall and winter flu season and utilization of federal funding to help entities such as yourselves reopen smartly and in the most effective way. Next slide, please. So when I say COVID realities, starting with pre versus post-vaccine, oftentimes we focus on what the country's going to look like once we have an effective vaccine or vaccines. The unfortunate challenge here is that COVID is going to be with us for the unforeseeable future. And the reason for that is because not only do we start from such a high baseline, unfortunately, as Dr. Fauci speaks to, but also there is a significant portion of the country that demonstrates they will not get a vaccine once one is available. And I encourage you to look at the Gallup poll from August 7th, because 1 in 3 is actually the best case scenario. It's even worse based on political affiliation, gender, age of the respondent. And so as we work towards solutions, it's really important that we leverage this funding while it's available to not only reopen, but stay open. That's key. And so to that, how to pay for it. And one of the key ways that we're helping our clients pay for it is leveraging available federal funding. First and foremost from the Coronavirus Relief Fund. It's the funding that the U.S. Treasury, as I spoke to, has provided all the states. Governor Murphy decided to allocate a little over $1 billion of that to the 9 most populous New Jersey counties listed here. And if you're in that these counties, we'd encourage you to reach out to your contacts within state and county government and ask them what their plans are for assisting schools and municipalities with utilizing this funding before it's clawed back at the end of the year, because much of it hasn't been utilized yet. Now, this funding can be utilized for all sorts of things. It can be utilized for PPE, overtime work. It can be utilized for emergency responders, can also be utilized for the kind of work that we can help you with, which is addressing airborne and surface spread of COVID. Moving on to FEMA, and we have partnered with a national FEMA vendor to help assist you with unlocking this funding for the types of measures that can be implemented that the CRF cannot fund, so that there's a holistic, comprehensive way to help pay for this utilizing federal funding. And something that's really important to highlight is how to go about procuring these solutions. As you are well aware, the state has implemented or issued an emergency declaration. Some municipalities have taken it upon themselves to also issue emergency declarations. That gives them the means to procure services using emergency declaration status, which allows you to more expedite the procurement of these solutions. We have consulted with Mark Pfeiffer and others in state and local government, and we also can provide you with model emergency declaration resolutions if you're so interested, and look to help you implement those within your local government entities. Next slide, please. So when we talk about the SiteLogic difference, we like to think of ourselves as bringing a new standard of service to New Jersey. We are a multidisciplined team made up of architects, design engineers, construction managers, energy service professionals, facility analysts, finance experts. And what we offer is a one-stop shop solution that can ensure that you get the most comprehensive project possible with multiple investment levels of options that look at a comprehensive suite of technologies. We, as our references will back up, and we're happy to provide you references at any time to support how we have a track record of ensuring fast and efficient completion of projects and budget and schedule assurances, no change orders, and always deliver projects on time or quicker. We leverage local businesses, not only local laborers and local businesses to deliver the work, but also local businesses as providers of these solutions to the greatest extent possible, so that the monies go to work in your community. And as we spoke to, we leverage federal funding and always value engineer our projects to get you the best return on investment at the lowest fee. Many entities I know are utilizing several vendors as a team, and we understand this is an unusual time, and people are seeing various ways to go about getting some of this work done. We're concerned, and we recognize that there's best practices to ensure that you get the most effective utilization of federal funding at the lowest cost by utilizing a vendor that has everything under one roof. Next slide, please. So when we talk about engineered infection protection, that includes airborne and surface contamination technologies, such as some of the ones that are listed here. So we spoke about ionization. That's a bolt-on technology that goes onto your rooftop or air handling units. We talk about ultraviolet germicidal irradiation. This is UVC technology that New York MTA is currently installing in all of their subways and buses. You see a lot of this ionization technology in airplanes and hospitals. So it's proven and cost-effective and helps kill over 99% of COVID in the air within 30 minutes. MERS 13 and higher filtration filters for your HVAC systems, increased humidification, which can help mitigate COVID during the winter months. And then surface contamination, everything from antimicrobial countertops, portable UV systems for your firehouses, police stations, and automatic touchless doors and bathroom fixtures. So we look forward to speaking with you and working with you, and encourage you to reach out to us so that we could set up some time with you and your colleagues and talk through this in greater detail, look at ways that we could help you unlock federal funding to pay for it, and give you some examples of the ways that we are providing these services already among some of your peers across New Jersey. I'm looking forward to having Caleb Stratton join this call in a little bit. He is the Assistant Business Associate Administrator, I should say, and Chief Resiliency Officer for the City of Hoboken. And we're currently working with the City of Hoboken to help implement EIP across the city. So with that, I'll turn it back to Carlos and the team, and look forward to your questions and getting to know you and working with you, hopefully. Thank you.
Great, thanks, Peter. I want to highlight some of the things you said, because as I speak to mayors, and Lou Alamo knows this well, and he mentioned his firm being one of the largest diverse firms, there's a big push to buy local and to buy diverse in New Jersey. So I want to confirm that as you're putting together these project teams, you're still able to use local vendors and vendors that are diverse and reflect the diversity of New Jersey.
It's a great question, and it's the way we do business. It's the way we do business. So we look to you to guide us towards vendors that you prefer, and to include on getting quotes on the full suite of options that we have at our disposal.
Okay,
Carlos, I'll jump on top of that as well, if
sure.
that's okay. Please. Yeah, it's. I've often said, and Pete's heard me say this. It's rather personal to me. I grew up in New Jersey. I pay taxes in New Jersey, and a number of my family, as well as I, reside there. So it is important that we employ New Jerseyans and keep the money within the state line. So I know there's some folks potentially from New York. We do the same there. We get it.
Understood. And explain to me again, and I'll just use a random example. There's some sort of upgrade that could be made to the ventilation and air conditioning system. That's $1 million project. You help the municipality only pay $250,000 of this project in this scenario?
Well, yes. In fact, it's a $2 million project, and all of it is going to be paid for with federal funding.
Yeah.
Okay.
What they did, Carlos, there was they identified what the CARES Act measures were available to them, what would be covered by CARES Act, and that's what they've implemented in their facility, one of which is ionization, which you talked about. That's right. And what we've seen here with the federal funding for COVID is that much of it is duplicitous. So FEMA funding is duplicative with funding from the CRF. So there's multiple different ways to take a bite at the apple, so to speak. And so what we would look to do is work with you and your grants administrator and team to identify the source of funding which provides you the maximum reimbursement.
Have you worked with risk managers at some municipalities? I know Alamo has acted as a risk manager, so they could be a partner with you, possibly finding solutions and bringing monies to a municipality.
Yes, thank you, Carlos. I think that a lot of education and awareness needs to occur, because as we begin to prepare to open up our schools or contemplating alternatives that we have, I think there's a need to get the word out that the technology exists through the HVAC systems and some of the ultraviolet technology, ionization and so forth, to really make it a much safer environment. How much confidence can you give, say, a superintendent or a mayor looking to?
I think Lou froze up there. I'm going to finish his question for you.
Okay.
I think he wants to know, if a superintendent is counting on you, what's the comfort level of you cutting the ribbon to the school or the facility?
Well, I mean, this is our bread and butter, working with school districts. So the most important thing for a superintendent, and we talk about having a tough job right now, getting school reopened, is to help instill community confidence among teachers, students, stakeholders in the community. And the best way to do that is to provide every measure possible, from signage to HVAC to surface solutions, plexiglass barriers, the full Monty, to ensure that there's a comprehensive set of solutions in place to mitigate airborne and surface spread of COVID. And that's what we do. That's what we do. And so there's a high degree of confidence among superintendents we work with. And that's our job. We're tasked with helping not only make them look good, but also ensure that we are protecting the health and safety of their stakeholders.
Sure. I was recently in Atlantic City, and I know as I entered the hotel or the casino, there was a what's it called? A thermograph? What's the
thermal
proper?
Scanner?
Thermal scanning.
Thermal scanner. That is something that would be covered under this grant if a school or a municipality wanted to install that at their entryway?
Yes. So there's a lot of different thermal scanning technologies. We looked at over 50 of the best, and our technical engineering team narrowed that down to 2, which we are utilizing. And so all of our solutions go through a rigorous review process to ensure that not only are they the most cost effective, but they're backed up by the highest standards of technology and science.
And
those are some measures that are included.
Sorry, Pete, to step in. They're scalable as well, Carlos. So, you tend to look at thermal scanning as a big main entrance. They also have portable as well. So we can scale it to whatever the situation.
We did field some questions. So the inevitable question came up. A lot of businesses wanted to know, do they have any options to apply for this? This is strictly for public entities?
Well, not exactly. So some municipalities actually have designed small business grant programs through funding that they have received from their counties in New Jersey from the coronavirus CRF, Coronavirus Relief Fund, and Hoboken is one example. There are others, and we expect that future rounds of federal, state, and local funding for COVID will expand upon or make utilization of existing sources of funding more permissive for things like that for small businesses. So I would encourage your members to reach out to their municipalities and learn more about.
Yeah, I will be doing that because I am already collaborating. We've helped over 300 businesses apply for funding through various, the PPP and the EIDL program. So it would be a natural, we kind of already have that Rolodex. We've already been assisting members. So it'd be very easy to pivot. Many are beauty salons and folks that really could use this technology. So that's great news. I didn't even realize that as we were setting this call up. I'm definitely going to be in the ear of several mayors asking them to extend it to their small businesses.
Good.
You had used the example before, Carlos, around FEMA. We encourage anyone that's listening to go back as far as January for any PPE, anything you've spent. And it's a 2-click process right on our website. And we spell SiteLogic with a Q at the end, by the way.
Okay.
But it's a 2-step process to apply to our partner, CRG, who is very adept with FEMA funding, worked through the Puerto Rico process when the hurricane blew through there. And you'll get a call within 48 hours when they apply to tell them exactly what they should gather as far as receipts and go from there. Pete talked a lot about the CRF and going forward. But if you want to go back as far to January and gain some of that 75% that you discussed earlier, it's not a bad idea here.
I'm going to ask you again because my members do this to me. So you're telling me that if there is some CARES Act money, it's possible that the project would be 100% covered?
Through the CRF, that's correct. FEMA at 75-25. Some states have taken CRF funding and made entities whole on that other 25%. New Jersey, to my understanding, has not done that yet. But because New Jersey has so much of the CRF funding that's been unallocated or unspent, it's our recommendation that is the line of first defense for for entities looking to unlock that funding to address COVID in their buildings.
So some counties, I know it was depending on census data. I'll give a little plug. That's why it's so important to fill out the census. But some of the counties that missed by like 1,000 residents missed millions and millions of dollars.
Yeah.
But the ones that were over the 500,000 and received the funding, they could offer that in theory to their municipalities, is what you're saying, to cover that 25% balance.
Correct. That is, there's precedent for that, and it is a part of the Treasury guidance. It's an allowable expenditure.
Okay. So is it fair to say the very worst, if I'm a mayor, is I'm going to pay 25%, but a very good chance I'm going to pay less than 25%, as long as I lobby my legislators and my county executives, et cetera?
That's correct.
Okay.
And that's not even including future rounds of federal funding potentially.
Yeah.
Okay.
And so to that point, the way we start this process with our clients is we will come in and do a full assessment of your buildings. We will bring in our team of engineers and look at everything from soup to nuts and come back to you within 2 weeks with several investment levels of EIP and sit down with you and go through not only what our recommendations are, but also what available funding there is to utilize to help pay for the project, and then not only the procurement vehicles, but the best way to go about designing and implementing it, utilizing local businesses.
Gotcha. How much, what's the fine line on ancillary repairs, upgrades to a building that are somewhat COVID related? Is there a black and white measure, or is there areas that could be gray? Is there something you could speak about? You know, what's your typical upgrade to a facility? Is it some of the equipment that we've talked about? It
is. So we're looking at $1 to $2 million average project size. So this is something that is, in my humble opinion, a cost-effective way for entities to leverage this federal funding to help invest in upgrading and future-proofing your buildings. And it's not just about addressing COVID now. It's about addressing COVID for the months and years to come. It's about addressing COVID during the next flu season. As we have seen in history, every second phase of pandemics has been worse than the first. Every second wave has been worse than the first. And we expect that this will be, unfortunately, no different, especially because of that baseline of where we are with national daily numbers. New Jersey's done a fantastic job, but we are in a cold climate. And so, and the other benefit to these solutions is they help save energy in many cases, and they also help address things like productivity, allergies, asthma, health and wellness, productivity, and absenteeism within the school environment for both teachers and students. So there's a lot of ancillary benefits beyond just COVID mitigation.
That was said very well by Pete. And just to add, there are long-term benefits, as Pete discussed, but we've come up very quickly with a list that are FEMA fundable measures, I'll call them, installation of what we install, that we know to a high degree that is going to be reimbursed by FEMA. And from a CARES Act funding standpoint, we have an idea, given the folks that we've worked with, what is reimbursable through the CARES Act.
Got you. I want to shout out, I know I just got a text that there's 25 school board members on a page watching us. So thank you for all you guys do.
Yes,
I know it's a very critical job that you're doing right now in this environment.
Absolutely.
Can you speak to anything that's more specifically for the school age children? Would it even cover mask and teacher apparel that they might have to wear, masks, face shields, or is it only physical facility upgrades?
The FEMA Public Assistance Grant Program that's funded through the CARES Act is first come, first serve, and that includes PPE. That includes everything that you just mentioned. It includes things such as hand sanitizer dispensers, hand washing stations, So we'd be happy to sit and talk with you about the comprehensive list of what's eligible for FEMA funding that's temporary, what's not because it's more permanent in nature, and the way to blend various sources of funding to help pay for something that's holistic and effective.
And I'll add, and this is not a SiteLogic advertisement here. If you go to our site, our partner CRG, if they were to apply, that school district that you just talked about, and the 25 constituents or 25 folks that are there from that school district, if they were to apply, CRG, who is also a FEMA reimbursable firm, so 20 or 75% of their fee would be reimbursable. We'll take you through the process, take you back to January 1, all that PPE and everything you've purchased, 75% of that will be reimbursed.
That's right.
I see that Caleb came in, so if you want to go live, Caleb, and unmute yourself. You're from Hoboken, and I know you're a happy customer, so thank you for joining us. Could you tell us a little bit about the process so other business administrators and mayors could feel comfortable on what it's going to be like?
Sure. My name is Caleb Stratton. I'm the Assistant Business Administrator for the City of Hoboken, and since March 1st, I've been the Acting Business Administrator, so I got a promotion and a birth by fire kind of quickly going into COVID. Pete and his team and the SiteLogic group came to us last year, I think, and we began our conversation talking about facility management and really master planning, capital investments, looking at a program manager that could both do investigation, construction management, help us do due diligence and procurement, and set us on a course to either stagger or weigh investments, one versus the other, provide us something objective about useful life, needs assessment, and really put that in a program for us to make informed decisions. There's constant competition for funds, and we saw what they were doing as something that was extremely valuable and on the front end, cost effective for the city. So very low cost, very low bar for entry. That our relationship with their group quickly developed into something much more. And SiteLogic was able to very quickly retask and support the city in our efforts in developing an engineered infection prevention program, as well as helping us do procurement for what I would consider to be high demand items right now for reducing the transmission or infection rates of COVID-19. And they have helped us with financing strategies. They have been supportive in expanding their scope and what they're willing to do, I'd say, outside of maybe our traditional contract, but just basically being available, being responsive. And they've been helping both myself and Mayor Bala kind of navigate these last 6 months, and they provided some level of certainty and I would say a third-party professional support. So some of the stuff we're working on is not inexpensive. So doing, for example, antiviral, antimicrobial counters at the police department headquarters for these areas with high traffic, high common touch points. These aren't things that are necessarily inexpensive, but having a provider like SiteLogic and then their suppliers to be able to support it. It's not just me making the recommendations, it's their group. So I'll leave it there. And Pete asked me to come on and just say a couple things, and I'm happy to answer questions or provide more color to what we already discussed, but they've been supportive through the CARES Act and through FEMA. And it just gives us the confidence we need, especially with the city council. We've had a terrible budget year. I'm sure there's a lot of municipalities. So we get, between what we want to do and what the council lets us do, there's just having their group as a supporting factor has been very helpful.
Yeah, I would say an organization like SiteLogic to navigate that makes it easier, and certainly a mayor and a council is welcome when they know it has no impact to the budget. You can't turn down the free money.
Yeah.
Well, you could. It would be a poor decision, but
That's right, Caleb. Yeah. And too many municipalities do. They just, out of inaction or not knowing that there is a partner like SiteLogic, do let a lot of money escape from the potential that they could do good for their municipality.
Sure.
I know some
Peter,
questions you
yeah.
answered, Dan. We're just asking for contact. We'll keep on putting it out there, but if you guys want to, Dan and Pete want to give your email, and then we'll also put it in all the literature that goes out afterwards.
Peter, in the question and answer, there's a question about email. I fired mine off. If you want to go into Q&A and just fire yours off, that'd be great. I didn't know if you were Peter Rarig or Pete Rarig, so didn't want to get it wrong.
Will do. Thank you. I did not see that, so I will.
And we'll repeat this in
respond
our
time.
newsletter. We'll send a live link. This is being recorded, and I'll have all the contact information. We'll do it to our database also.
Thank you.
Dan's is easy, though. It's dan.madden at SiteLogic with a Q at the end.com. So that's a pretty easy one.
Yeah.
And I won't, my last name is spelled Roehrrig. So peter.rarig at SiteLogic.com. Dan Madden's a little easier, so feel free to email him, and I'm sure I'll get, we'll collaborate and
Absolutely.
help you get started.
And if he's not answering, tell me.
Yeah.
Off topic, Caleb, how is the outdoor dining going in Hoboken? I thought I saw some pretty cool stories about streets being closed and expanding sidewalks.
Interestingly enough, it's been a concept that we've been pushing for a couple of years now. So it's been very successful. We've had a handful of instances where businesses have been like, I don't know if we would have made it through this year if we weren't able to do this. So it's been a good season. It's been a lot of work for our engineering group, and we're proud to be able to move the levers of government in the right direction for once and kind of use the right of way for something better than just parking. So it makes me, I'm very proud of my team that they were able to do that quickly, and it's been successful, and we're going to expand it. We're expanding it through the end of this year, possibly into next year. I'm hoping that it becomes part of our business as usual practices, where we are just helping to support our local businesses.
Excellent. Yeah, no, I've enjoyed watching many of our members pivot, but I was born and raised in Hudson County, so it's kind of cool to see Hoboken. You have such, natural ability to do that on the sidewalks. And I remember a colleague of mine years ago saying they should just close Washington off and make it like smart cars or bikes, like certain parts of the year. So I won't put you on the spot if you agree or disagree, but
I agree. It's impractical for 100 different reasons, and our police and fire groups have a difficult time with it.
True.
We're trying that, and it's called a WUNRF. So where you basically try not to differentiate the areas between the curbs and the sidewalks. So we're doing that. We're going to start trying to do that on Sinatra Drive South and the South Waterfront. There's a couple of other opportunities throughout the city, but right now supporting businesses, some is good, more is better. We're closing Washington Street for a period of time, Thursdays and Sundays, to get people and businesses the ability to go out and breathe. But there's a very vocal constituency that would not support closing Washington Street only for that.
Gotcha. Understood.
But yeah, it's fun to think about what the good and consequential things that come out of COVID-19. This may be one of them, just activating streets in a little bit of a different way.
Caleb, the SiteLogIQ team mentioned that they could, through a municipality, offer some of these grant monies to businesses that needed to work on their facility. So I offer the chamber as a resource. If you decide to do that, let us know. We've helped a lot of small businesses. That's what we do. That's what we love to do. So if there's beauty salons, restaurants, other businesses that could use any of the products and services that could be covered through FEMA, and some CARES Act money was used to offset that, we'd be happy to collaborate with you guys.
Okay, that sounds fantastic. I'll make sure to pass that on. We've got two groups. We have a Hoboken Business Alliance.
Okay.
Set up in the last year. And then we have a Hoboken Relief Fund that we're pushing out information through. So I'll let that group know.
Definitely. Peter and Dan, any other comments? I think we've answered the questions. Any that have come in that have been answered, I wouldn't repeat. But any more comments on the process, on the things that are covered? again, it's great free money. I hope folks take advantage of it. I anticipate you'll be getting a lot of calls, and I'll be sure to share this with the various mayors and executives at county government.
Yeah, I just have one thing to add. It may have already been covered, but not only just the money that's available, but the costs, the administrative costs associated with that are also covered as reimbursable expenses. So if someone's considering using the program, they're like, man, we really don't have the in-house staff. It is a eligible expense. You can bring, whether through the SiteLogic team or through it, or you can bring on people to help you in support of doing this too. So it's not just a tranche of funding that's out there to grab. It's also the administrative or staff support you need to line up a project. So that I just think that's an important thing to add. It's not always known, but it's just an important point to make.
That's a great point. So if I had an admin person that I would dedicate to this implementation, that salary would be reimbursable or covered.
To some degree, yes. I mean,
yeah, that's great. That's great.
Probably knows better than I do what's eligible, but we have submitted for direct administrative costs associated with these type of programs, and they have been reimbursed. So
that's great information. I appreciate that. Yeah.
Pete, I'll let you close with anything you want.
Thanks. Thank you, Caleb. Really appreciate your vote of confidence in us, and we're grateful for the opportunity to work with you and the community to help make these resiliency investments to future-proof your buildings and address health and safety across Hoboken. So it's something that we want to do more of in New Jersey, of course, throughout New Jersey. As Dan said, there's a lot of, we live in New Jersey, and it's a place that we have a great deal of love and admiration for, and we want to do everything we can to help out, to restore confidence and prepare folks for the coming flu season. And so these are great investments. They're effective technologies, and we're prepared to help you implement this program in a very expedited fashion.
Thank you, Carlos.
No, thank you. Thanks, Alamo. Thanks, SiteLogic, for helping sponsor this. And please, thanks, Caleb, for the behind-the-scenes look at what the process really looks like. It was a great commentary. So
I apologize for being late. I told SiteLogic folks earlier in the week, I'm like, yeah, I'm clear at 3, and then our council president moved our agenda meeting to 3.
It worked perfectly. You came in right after the presentation, so we do appreciate the time. And again, anybody, this will be repeated. We'll share it in our newsletter that goes out to 22,000 people. We'll add the SiteLogic contact information, but anybody who has my contact, if you cannot locate it, I will connect you with the folks at SiteLogic. So again, thank you. Enjoy your Thursday and stay safe, everybody.
Stay safe. You're right.
Be well.
Thanks.